Hello, everyone, and welcome. My name is Konstantina Boumaki, and it's a real pleasure to moderate today's Blue Circle Talk about women leading change in diabetes. This event is organized by the International Diabetes Federation in the context of International Women's Day. Around the world, women play a central role in diabetes care and advocacy as caregivers, health professionals, researchers, community leaders, and advocates. Many of these contributions are often invisible or not recognized at all, but they have a huge impact on families, communities, and health systems. Today, we want to highlight exactly that, the power of women's voices and leadership in diabetes. I'm joining you today from Greece. I'm a medical doctor, a patient living with type 1 diabetes, and also a very proud young leader in diabetes alumni. It has been 11 years since my first YLD training, and I need to say that I'm super grateful for that, as it was an amazing experience. But you will hear more about my advocacy journey later on. We have some quick housekeeping points before we begin. This webinar is being recorded. You can activate Zoom-generated subtitles using the CC button at the bottom of your screen. Of course, keep in mind that they are not 100% accurate. The recording slides and feedback questionnaire will be sent to all participants in the coming days. Participants who attend at least 80% of the event and complete the feedback questionnaire will receive an attendance certificate. This certificate will be sent next month in April, so wait for this email after April 6th, and please watch your spam too. And finally, please use the Q&A function to submit questions for our speakers throughout the session. Before we start our discussion today, we would love to know a little more about you, our audience today, and your connection with this topic. We have prepared some introduction questions, nothing too big, it's not an exam, and there's not right or wrong answers. So you can join the Slido through this QR code and answer the first question, which is, what IDF region are you from? If you're joining through a mobile phone, you can go to your browser and just join through slido.com and enter this passcode. Of course, if you have any issues to open Slido, you can contact, you can message in the chat. It's not a contest, but I see Europe is winning. I'm kidding. Please take your time. I know the first question will be hard for you to join Slido and then answer the questions. We will be faster in the next questions. Let me open it too. The next question is, what best describes you, your connection to diabetes? You can choose multiple if you have multiple choices. And for the people who are answering in the chat, we would love for you to join Slido and answer there, as we can see the results on the screen. Wow, a lot of healthcare professionals. The next question is, do you think women's diabetes-related specific needs are adequately addressed. Of course, there is not right or wrong here. And I think that we will have different options depending on where we live, right? Yeah, partly, I think, sums up everything, right? Yeah, a lot of partly options in the chat too. And then our next question is, which women-specific diabetes-related issue do you think is most overlooked? We would love an option, all of the above, right? It's very interesting to see how it changes when people are starting to answer this question. Because again, it depends on where you live. And then the next question is, where do you think action would have the greatest impact for women living with diabetes? Health education is mostly chosen. The chat is on fire. And thank you to all the people who joined. We're 265 people in this event. Thank you all for joining. And this is our last question. In just one or two words, what does give to gain mean to you in the context of diabetes advocacy? Think about your background, think about your experience. It's not so hard, right? Compassionate care. I love this. Supportive advocacy, positive action, hope for the future, support, care, kindness. For the people who join now, you can join through this QR code, or if you are through a mobile phone, you can go to your browser and join through slido.com and press this passcode. But all these answers, I think, are amazing. There is hope, kindness, support, care, compassionate care, supportive advocacy is the majority, support and education, generally support, yeah, empowerment, paid forward. Love this. And now we will start with a welcome message from IDF leadership. We will watch a recorded message from Dr. Noor Al Busaidi, chair of the IDF Board Diabetes and Women Committee, who will share a few words about the importance of women-led contributions to the diabetes community.
Hello, everyone. On behalf of the International Diabetes Federation, it is my pleasure to welcome you to online event in celebration of the International Women's Day 2026. This year theme, Give to Gain, truly reflect what we see every day in the diabetes community in countries and culture everywhere. Women play an important role in diabetes care. They are caregiver, taking care of loved one with diabetes, health care professionals delivering essential services, researcher advancing knowledge, and advocate raising awareness within their community. Much of this work happened quietly without any formal recognition, yet its impact is undeniable. It strengthens healthier families, contribute to a resilient health system. When women lead, communities gain. When women are empowered, prevention efforts are strengthened. When women's voices are heard, policy become more inclusive and health system more responsive. In diabetes care, women-led contributions are not only valuable, they are transformative. They bring lived experience, compassion, resilience, and innovation. They bridge gaps between clinic and communities. They challenge stigma. They create safe space to discuss about diabetes and mental health, diabetes and sexual health. They ensure no one is left behind, especially in under-resourced areas. Today we gather to recognize this effort and to reflect how small acts of advocacy like sharing personal stories, mentoring others, organizing community activity, or leading local initiative can grow into meaningful change at the national, regional, and global level. As we listen to our inspiring speaker, I invite you to consider the impacts of women leadership within your communities. How can we better recognize and support these women who are already giving a lot? How can we work together to ensure that their contribution translate into a better health outcome and healthier future for everyone? Thank you all for being part of this important milestone. Together, let us celebrate, learn, and continue building a diabetes community where women's leadership is visible, valuable, and empowered. Thank you all for joining. Welcome to our event.
Wow, amazing message. And we must all thank Dr. Noor for those inspiring words. So now we move on to the next part, the webinar. Diabetes Advocacy and Awareness, Give to Gain. Today we will hear from incredible women from different parts of the world who are creating change in their communities through diabetes advocacy, education, and leadership. Each speaker will have about 5 minutes to share their initiatives and experiences. Sorry. So before I share my advocacy journey, I want to start with the first woman who inspired me, my mother. When I was diagnosed with type 1 diabetes as a child in Crete, she helped create a local diabetes association so that children like me would grow up in a safer and more supportive environment. She probably didn't realize it at the time, but that was my first lesson in advocacy. That experience showed me that change often begins with one person who decides that things can be better. Later, as I said before, 11 years ago, I had the privilege to participate in the YLD program of IDF in 2015. That experience really changed my life. I was there, it was there that I truly understood what advocacy means and where I met many inspiring women from around the world who were leading projects, supporting their communities, and creating change. Seeing what they were doing made me realize that patient voices are powerful and that we do not need permission to advocate for what our communities needs. I was very lucky to be surrounded by people who were always supporting me to advocate as much as I wanted from a very young age. So when I turned 18 and met so many people from around the world pushing for more, creating change from nothing, and even some with no support system at all, I was very inspired to push for more. I was creating a lot of projects in Crete, and in Greece for awareness, but I felt that that wasn't enough as the system is broken. That's why I pushed for more. Over the years, advocacy has given me opportunities to speak in conferences, work with organizations like IDF Europe, the European Patients Forum, where I'm a board member there now, and work closely with institutions and agencies like EU Commission, the European Medicine Agency, OECD, and collaborate with many amazing women across the diabetes community. I must say that most of the people who work in these high-level meetings are women. I'm not saying. But advocacy is not always easy. In many places, including Greece, it can be challenging to be a young person and sometimes even more challenging to be a young woman trying to bring change in health systems. Sometimes people may underestimate our knowledge or our lived experience. That was my experience when I started being more involved with the Greek federations. But living with diabetes gives us expertise that no textbook can teach. And what I have learned through this journey is that when women are supported, share their experiences, and speak up, we can create real change in our communities and health systems. And most importantly, no one has to do this work alone. The global diabetes community, through programs like YLD, Blue Circle Voices, is a huge family. If you ever feel alone or unsure, there are people around the world ready to support you, share ideas, and help you move forward. Because together our voices are much stronger. Thank you. And now I'm very happy to introduce our speakers who will share their experiences as well. First, we will hear from Isabella Maggi, an IDF Young Leader in Diabetes Training and Diabetes Australia Ambassador from Australia. Isabella, you can take the floor.
Thank you. Hi, everyone. So I was diagnosed with type 1 diabetes 17 years ago when I was 11 years old. Similarly to you, my mother's voice actually saved my life after a male doctor misdiagnosed me. And I guess when reflecting on why I was chosen to speak, I opened my camera roll, and these are only some of the women in my diabetes network that I've come across, and they're all very inspiring to me. There are a few projects that I am currently working on. So I am an IDF young leader in diabetes for the 2025 to 2027 cohort. And my IDF project focuses on advocacy awareness as an awareness resource. So it's designed to equip diabetes advocates, and whether you're an advocate for yourself or for others or in the space professionally, to give them the skills and knowledge that they need, whether that's to navigate health professionals, parliament, whatever it may be. I also co-host a podcast with Diabetes Australia. And I also am a co-author on an eating disorder prevention program research paper, which has just been accepted for publication as of last night. Thank you so much.
Thank you, Isabella, for sharing your inspiring work. Then we continue with Marlena Rolla Wilson, an IDF Young Leader in Diabetes mentor and registered nurse from Thailand. Marlena?
Sawadika, and hello everyone. My name is Milena Laura Wilson. I'm currently based in Thailand and I am a registered nurse. So I joined the Young Leaders in Diabetes program back in 2022 or 21, just after COVID, I believe, and I graduated in 2025. So now I am a Young Leaders in Diabetes mentor. So I got diagnosed with type 1 diabetes when I was 8 years old. So I've been living with type 1 for about 16 years now. And as far as I can remember, when I first got diagnosed, no one really seemed to understand what I was going through or seemed to know how to communicate that to me. So I decided that I would pursue nursing, because I felt like if the first step, the first person you meet when you get diagnosed is either your doctor or your nurse. And I wanted to be that first line of care to my patients once I get to the point of becoming a diabetes educator. So right now I'm still a registered nurse in Thailand, but I'm working towards becoming like a nurse educator in type 1 diabetes because I want to work with other people like me. So yeah, that's about it for me. I'm not really affiliated with anyone, so I do a lot of work for the Thailand Diabetes Association. But yeah, so if anyone would like to reach out, I am free. Thank you.
Thank you, Marlena, so much. And before we continue, I want to thank everyone for joining. I see that the numbers keep increasing. We have over 300 people joining. So thank you for those who joined later. And now our next speaker is Kerry Murphy, an IDF Blue Circle voice from the United States and founder of Follow T1Ds. And thank you for joining so early. The floor is yours, Kerry.
Hi, everybody. Thank you so much for having me here today. I am Kerry Murphy. I am the founder and executive director of Follow T1Ds and Follow T1Ds Policy Council, and I live in Virginia in the US. My connection to type 1 diabetes began with my sister-in-law nearly 30 years ago, and then was followed by my husband, my niece, and then 8 years ago, our daughter. Like many mothers who manage their child's diabetes, my advocacy grew out of the work I do every day managing my daughter's diabetes and learning how to navigate it at school and activities and birthday parties and sports and everywhere she goes. About 8 years ago, I began connecting with parents on social media like a lot of us do. The only thing I love about social media is the access to the diabetes community and how we really do help each other learn how to take better care of our children. About 3 years ago, I began connecting with parents across the US whose schools were refusing to use the Dexcom Follow app or a CGM, remote caregiver app to receive audible alerts on an iPad or another device while the child's at school. A lot of schools we're requiring parents to monitor these alerts and then call the school if they noticed a trend and leave work, all to, call remotely on campus away from where their child even is from them. So there was a lot of frustration in the communities about that. Many of us realized we were trying to solve the same problem with our school districts on our own, and we were all quietly being told, nobody else is asking for this, and you're being difficult, or your child doesn't need this. So a lot of us came together. We created Follow T1Ds to connect families and make U.S. Schools and other parents aware that the Department of Justice in the U.S. Had delivered some mandates to several school districts that basically said that when parents ask for schools to receive these alerts, that it is considered a reasonable accommodation under the federal law, and that if schools were refusing this, that they could be in violation of that law. So in 2023, this became a full-time focus. Recently, my team and I incorporated our organization into 2 nonprofits. Follow T1D's Policy Council will focus on policy and legislative advocacy. So the experiences of students living with diabetes are represented when decisions about their care are being made. The other nonprofit, Follow T1Ds, will continue to help parents understand how to effectively advocate for their children at school, connecting them with other parents in their area, providing resources to understand the laws already in place in their state and across the US, and helping parents, schools, and providers collaborate. That's the most important one, so that students can safely access their education. What started as advocating for my own daughter has expanded 8 years later beyond our family, school division, our state and country, and has brought me here today on my second international webinar with IDF. For the last 2 years, I've been heavily involved working in my state of Virginia on legislation to update diabetes care and school laws that have not kept pace with modern diabetes care, many of which have not been updated in nearly 30 years. Last year, the bill I advocated for was delayed and sent to a committee that works over the summer to study the issue. But the impact was still felt all across the state, as many school divisions across Virginia began to change their policies simply because our calls for change in how diabetes is managed in Virginia schools reached the state level. This year, the bill was brought forward again in January. It's been just close to 2 months now. We have 1 week of this legislative session left. So far, the legislation has passed unanimously in both the Virginia House and the Senate. And in the next week, we'll know whether the final language will be passed into law or continue to be delayed. Either way, I am confident that our voices are being heard and changes will continue. After last year's work on the Virginia bill, I was nominated by my school board, the same one I struggled with 7 years ago, to serve on the School Health Advisory Board of our school division, where I contribute to discussions about policies affecting students with chronic health conditions. Part of what I do in Follow T1Ds is help parents understand that they are indeed their child's best advocate and give them the confidence they need to properly advocate for them. As my daughter begins managing more of her own diabetes, I will gradually age out of the day-to-day realities of navigating the current barriers to care at school. My goal is to shift from leading this work to supporting the next generation of parents who will carry it forward. They will be the ones living the day-to-day realities of managing diabetes and navigating schools, and their experiences need to continue to guide this work and shape all the changes that need to come next. Thank you so much for inviting me to participate in this discussion, celebrating our women advocates and highlighting our important work on International Women's Day.
Thank you so much, Carrie. And I know USA can be challenging, so thank you so much for your work. And before we continue, I want to mention, because I see a lot of questions about the YLD program, which again, I will say it's amazing. So you can learn more if you send an email to advocacy@idf.org. If you didn't understand what I'm saying, on the last slide, when we finish this session today, it will be written, so you can copy paste it, and they will give you all the necessary information. And also, the Blue Circle Voice is an amazing program too. You can contact IDF for that too. So now we will continue with Osarenko Efeltsima Nuogugu, an IDF Blue Circle Voice and founder of the Diabetes and Limb Salvage Foundation in Nigeria.
Yeah, my name is Osarenko, like it's mentioned. I'm from Lagos, Nigeria, a person living with type 2 diabetes. I was diagnosed when I first had gestational diabetes. But prior to that, my both parents died for complication of diabetes. So my journey has been history of parents living with diabetes. I don't want to die. I don't want to have complications. So, but I was lucky. I was diagnosed by an endocrinologist, and my journey was made very easy. So 25 years ago, the advocacy started. It began not in the conference room or policy space. It began with my lived experience and learning to manage chronic condition while raising a family, building a career, and navigating the reality of healthcare access in my community was what living with diabetes means. The term "give to gain" speaks deeply to my heart, and it speaks also to the women leadership in diabetes advocacy. For many women living with diabetes, like me, it comes to me naturally, the topic, give to gain. We give care to our families. We give support to others living with the condition. And we give time and education to our community. We give stories. We even give stories when it is difficult to share. What we sometimes do not realize is that giving, we gain. Like I have gained. I have gained community. I have gained support of family. I have been able to assist people, like you can see in my pictures. I've been able to be there for family, give my shoulders to people who needed that empathic support to go through the journey. Because even with diabetes, type 2 diabetes, when I was diagnosed, or gestational diabetes as a young mother, it wasn't an easy task, especially in a country like mine, Nigeria, that is very special, with different languages, different culture, different religion. It wasn't easy. But I gained more by speaking to people. I gained trust. I gained a community, like the Blue Circle Voices, like the RD Dog Voices. I gained the NCD Alliance family, a lot. So when women share their lived experience, like me, I am a voice, I'm an African, they call me Mama Africa, Mama Diabetes, according to the BBC. And people call me Madam Diabetes. Some people call me Mommy Diabetes. That's because I have become the face of diabetes in my community, in my country, and in African region. So when women share their lived experience, we give our voice to reality that statistics alone cannot explain. By doing so, we gain awareness, understanding, and empathy around us. When I met on newly diagnosed patients, I give them hope. And in return, we gain a stronger community of support. When I advocate for access of screening, insulin, quality care, I give time and my energy. And that I also gain a healthier lives. Like I have decided that my daughters, 5 daughters, beautiful daughters I have, will not come down with diabetes. Not soon anyway, not ever. That's what I've changed their meal, I've changed their lifestyle, and I've been able to bring their mind to think positively towards living healthy life. We exercise, everything around me, the community around me knows that. And I've done that. If you check through my pictures and see what I do, I live my everyday life making change about diabetes. So our journey reflects my life, my journey with diabetes reflects the truth. Living with diabetes has exposed me to a lot of many other challenges that ordinary people face. Late diagnosis, stigma, devastating impact of preventable complication. Instead of remaining in that state of silence, I chose to give my voice to this cause. So the decision that led me to establishing my NGO, Diabetes and Limb Salvage, is to also prevent the complication that took my both parents away, and I see in the society causing amputation and devastating hope. So in Nigeria today, Diabetes and Limb Salvage Foundation has saved so many people's lives, has been able to change the narrative for a lot of people. So through advocacy space like International Diabetes Federation, being a Blue Echo Voices, have been able to speak internationally to help people face the challenge of living with diabetes. So, and I have also seen that being a voice as a woman has given other women their voices to speak, even the young one. I speak in camp in Nigeria to help them look that diabetes is not about staying silent in your condition. It's embracing your condition and embracing the other positive things that come with it. So across the continent, I would say from Africa to Europe, from Asia to America, women living with diabetes should step forward, and not as patients, but as leaders, educators, and change makers. This is the true meaning of give to gain. When women give their voices, we gain stronger advocacy. When women give their leadership, we gain better policy. When women give their lived experience, we gain solutions that are grounded in reality. Like I have done, I have supported, I've joined hands with pediatrics from America. They come to Nigeria 3 or 4 times in a year to empower and educate our community, to help screen, to also empower the healthcare sector about podiatrists, because podiatrists is not even known in Nigeria. So these are the gains I will talk about that living with diabetes has brought to my life, and I have given back to the community. The women, I will want to say that for those women who are listening to me today, your story matters, your voice matters, your experience can inspire change in ways you may never imagine. So, and to our partners who are here, healthcare professionals, researchers, policymakers, global organizations, continue to create space for women, the voices of women living with diabetes, so that we can be heard, valued, and included in decision making. Because women are empowered to lead in the diabetes advocacy, and everyone gain. And on this International Women's Day, I would like to wish everyone Happy International Women's Day, and also that we should please give our voices, our knowledge, our leadership, so that together we gain a world where diabetes care is accessible, equitable, and compassionate for all. I remain yours, Lion Osaikwe from Nigeria. Thank you very much.
Thank you so much, Sarenko. And I couldn't agree more that women can inspire other women to start their advocacy journey or their work to be strong and efficient. So before we continue to our panel discussion, please feel free to leave your questions at the Q&A at the bottom of your screen, and we will answer them in a few minutes. I saw a lot of questions about the Atlas, which is available for free at the IDF website. You can go there, write Atlas, and you will see it. You can download it. But also, it is important to know that the Atlas data, it is an important source to support advocacy work. And IDF is organizing a webinar that is not yet out. So keep an eye out for that to register. But they will talk about how they collect the data and how you can use it for your own work. So now I want to thank all our speakers for these inspiring examples of advocacy and leadership. We will now move to the discussion panel. And I want all our speakers to open their screen, their cameras. Thank you so much. Isabella is like you're in a photo shooting with a...
It's just really hot here in Australia.
I can imagine. Okay, so again, please feel free to leave your questions. And the first question for all of our speakers is, what does give to gain mean to you in the context of diabetes advocacy and care? Very briefly. We can start my screen. I will not, I will start with my screen. So Zarenko, you're first. You're muted. Can you unmute?
Sorry, I didn't realize. What it means for me is when give to gain means we gain a stronger advocacy. We as women, when we lead, we gain a better policy. We as women, when we share our lived experience, we gain a grounded in reality lived experience. My journey is I keep telling people that living with diabetes is a blessing. And people they take it aback because where I'm from, they consider living with diabetes as a spiritual thing. They don't understand it that is a disease condition that can come on anybody. So it means give to gain means to me deeply as you want to hear the good part, living healthy. That's me. Teaching people, being a shoulder to people who need support, and then having a support group that both all of us can make a change in the policy. That's what give to gain means to me.
This is excellent. Carrie, you're next.
Thanks. For me, give to gain means sharing what I've learned so other families don't have to face the same barriers alone. A lot of what I do is help parents understand the laws and the technology and how to work with schools so they feel less alone when they're forced to advocate for their child. And the gain is that the next family doesn't have to reinvent the wheel when they start that process.
I couldn't agree more. And then Marlena, you're next.
So I would say similar to what Kerry said, definitely to me, give to gain in the diabetes aspect would be, I imagine it as handing a baton. So you open up a space or you open up a floor and you pass on the next best thing or the next project to continue spreading positivity and a positive impact for other people within the diabetes space as well.
Love this answer. And, it's the younger version, the lighter and more positive. Isabella, you're next.
Thank you. I think when we give our time, resources, voice, knowledge with other people, we can gain at a community, national, and global level across many different areas. An example would be with the podcast work that I do with Diabetes Australia, being able to provide other people with a platform to share their voice and experience so that the whole community can also gain from that.
This is the essence of advocacy, right? So Marlena, the next question is for you, but for anyone who has any insights can, of course, feel free to take the floor too. When women are empowered to lead in diabetes, what changes? What do we gain collectively when women step forward?
Okay, so to answer that question, I would like to share a personal story that happened to me recently. So it can kind of be in the context of women's spaces, but from Thailand, we have a lot of stigma in the diabetes space. A lot of people don't really understand the condition and we're kind of not seen fully. So so recently I tried to go apply to a hospital to become a nurse. And when I got there, I was ready to start. And they told me that I wasn't fit to be a nurse because I had type 1 diabetes. And to me, that was the first time I've actually ever experienced any sort of stigma regarding living with diabetes. So it was a huge shock to my system. And, but the bigger shock was I've never been told no, especially with diabetes. So my family have always been such a positive influence on me. My mother has been such a great support ever since I was diagnosed. So being told that I couldn't do something based on being type 1 diabetic was like a huge shock to me. So I feel like having positive impact or having other women in spaces really show and like influence other women that it's okay to like step up and speak your mind and, you know, own your space. So for the, you know, I to me, I thought about it a long time. I said, how could I apply this personal experience into International Women's Day? And just having women in the advocacy space really inspires and gives other women voices to want to speak up and make change. So I think that covers what I want to say, but I'm not sure if anyone in the panel would like to add on to that.
Thank you so much for this. And I really agree that we women face a lot of discrimination, I would say, but a lot of times they can say that you're not able to do this or you're not able to do that, let alone when you have diabetes too, because this is an awful thing for someone to say to you. But you are an inspiration for everyone here in this event, but also in your community that you succeeded. So you're a great inspiration. Kerry, sorry if I put you on the spot, but I would love to hear your experience too and your answer in this question.
I think, especially being a caretaker of somebody living with type 1 diabetes, my daughter, I think mothers are crucial. I think, you know, just statistically, we are most often the primary caregivers. So we are, you know, going to the doctor appointments, going to the school appointments and the activities and coordinating all of that. And I think when we lift up those voices and through my work helping lift the parent voice, and most often it is the mother, especially down here in Virginia, most of the people that showed up to advocate alongside me and bring their children to speak were the mothers. Not that we're better in any way. I just think that because of the way the world works, we just often have a better insight into how to manage care. And it's our voices and our experience using this technology, especially in the last 10 years, that really expedited our knowledge of how to properly use insulin and use the CGMs and to keep our kids in target range to avoid a lot of those complications later in life. And I think we are the ones that bring those realities and the importance of those realities into policy and into advocacy and into making the world a more adaptable and safer place for our kids.
Thank you for this. The next question is for Osarenko and everyone, of course, else who wants to respond. How did your family and community respond when you chose to advocate for diabetes? Has that response evolved?
Oh, my family response was quite supportive because I was very open about my diet because I started with gestational diabetes. I had 2 children prior to that, and I'm also a caregiver. I love empathy is my everyday thing. So raising my children, my family, my sisters, my friends, I was open about it. I was talking and living diabetes. So it became what everybody around me understood. So people felt comfortable to even share their lived experience. When I'm injecting my insulin, I do it publicly. So when I'm talking about it, people who were feeling stigmatized or feeling ashamed to come clean, they come clean. So my family accepted, gave me that support. They were there for me. When I have hypo, they are the first to respond. So it was quite, so going out across the world, they have my back. And family support is key, very important in managing living with diabetes, whether type 1 or type 2, or whatever one. You need the support of your family and support of your community, because it can happen anywhere you have hypo. So, but when they know you are a face of diabetes, they know what your condition is, they respond and not make a mistake in handling your hypo or hyper case. So my family really was a great support.
And I totally agree. This is my experience too, because you need the support. Things are not always easy, you know. Advocacy is very hard path. So you need to have a support system so you can continue your work. Some days are good, some others are very bad. So you need the support to push you to do better. And
But you have to educate your family. You have to educate them and let them understand. But if you don't give them that education, they are living in denial of what you do. This is going to be difficult. So my husband is educated, my children, but the family finance will be going towards your care, because in Nigeria, we pay from our pocket. So it's not where we have the insurance. So it's quite difficult here. So you have to have the understanding for them to give you that support. Teach them, educate them. So education is key.
100%. Carrie, do you want to add something to that?
Yeah, this is a complicated question for me, being that I have a sister-in-law, a husband, a daughter, and a niece, all living with type 1 diabetes. My middle son also has 3 positive antibodies and will be on his way at some point here. I think as far as like how my family responded to my advocacy, to some extent, it was expected because of who I am. And because of the situations we were put in with my daughter. But I think I've definitely found that the people living with type 1 diabetes in my life have a hard time advocating for themselves and for the accommodations that they need. And I definitely feel like that empowers me to speak for them and advocate for them in ways that they just almost emotionally can't, because they're managing their diabetes all day and regular life, and then to just try to convince other people that they need this or that or to understand this or that is just, they just don't have the energy. But it's definitely a fine line, because I don't live with diabetes, and I've said, of course, several times in the middle of the night when I'm tired and a pump has failed for the second time for my daughter, we always say, I hate diabetes. There's been a lot of discussion about how I'm not allowed to hate diabetes more than they are. I'm the one that says that. They agree. So there's, a fine line just emotionally of making sure that my advocacy isn't more for me than it is for the person living with diabetes. And I think that's really important. And then the second part to that is it takes a lot of sacrifice. I've been in an apartment in the capital of Virginia for the last 2 months, commuting on the weekends back home, and I've missed almost 2 months of the everyday with my 11-year-old. Fortunately, my husband's there, but it does take a lot of familial sacrifice, and I think that can be a difficult side of advocacy. I just wanted to highlight.
Carrie, because I 100% agree with you, and a lot of times parents are I don't know the correct English word because I don't want to be harsh, but your job is amazing, and I wouldn't survive at all if it wasn't for my mother. But I had my bad experiences with parents, which is not the whole parents are bad, or in the advocacy field. The important thing is that your experience is very hard, but completely different from mine. I have diabetes, but you also suffer from the diabetes life because you take care of your child. You wake up every night. I had hypoglycemia, like 20 years ago when I was diagnosed and we didn't have pumps and CGMs. every night my mother would wake up at 2. I had a hypo, then she would wake up again at 4 or didn't sleep at all while I was sleeping, and she was giving me honey. And this was her burden, not sleeping at all every night. So this experience, and that's what she taught me, that she can share her own experience, but of course not how it is to live with diabetes. Like, she doesn't understand if we have a whole day hyperglycemia, or if we have changes, how these affect us, or the mental burden, or how the community sees us. But she has a different experience, which is very important. And parents needs to be in the advocacy field. It is not something beyond, like, you have a different experience. And when you have this line of like a boundary, that you have your own experience, but you can go into a lived experience, a person living with diabetes shoes. So this is, I think, the best balance.
Yeah, absolutely.
Yeah. And now I have a question for Isabella. As a woman, do you ever worry about your physical safety or credibility in a health emergency?
Thanking you. Look, it's hard. Hey, even in a country that recognizes equal gender rights, yes, I could give an example where I had a really bad hypo experience and I was on the floor. I basically had a seizure. But the first thing I did when I had regained consciousness was check my clothing, that I was fully covered, because I was on the floor and I didn't know who was around me. And I didn't know if the men that were there to even help me are safe. And it really puts you in a position when you're already extremely vulnerable, can't talk properly, look drunk. It just heightens in your mind, am I going to be taken advantage of?
Couldn't agree more. So the next question is for Marlena and Carrie. How can women turn their everyday experiences with diabetes into meaningful change for themselves and others? How can their leadership transform prevention and care at community level? Marlena, you can start.
Okay, so my take on advocacy, and because my big thing in my circle in my country is promoting education and a more positive outlook, that even though type 1 diabetes is a chronic illness and it does have its ups and downs, it shouldn't be looked at in a bad light, because the stigma here is real. But I think it definitely starts internally. Being mindful and being kind to yourself is definitely very important. I think as long as you have a good mindset and then you're not beating yourself up, because advocacy is hard. And sometimes you feel like you're not doing enough, or you're not reaching enough people, or you're not doing enough change, and you're putting extra pressure on yourself. I think at the end of the day, you need to understand that every voice matters, and especially being able to share your views and share your points and be able to push forward proper impact, as small or as big as it can be, I think always is valid. Yeah, and of course I really liked how we are talking about our mothers here, because I would say my mother was also one of the first advocates for me as well. Like, as far as I can remember, like, she was always there for the worst moments in my life. And really, we don't give enough credit to the caregivers and our mothers for what they have done to raise us and what they've been through, because it hasn't been easy for them either. If Carrie, you would like to take the baton next.
Thanks for that. It's interesting because it pivots right into, everyday experiences as a primary caregiver for a young child. My daughter was 3 when she was diagnosed. Those everyday experiences are not everyday experiences for most people. It is overwhelming. It is stressful to not be in the body that you're taking care of. I mean, we all, as mothers, understand that to some extent with our other children, but with diabetes, it's just a whole nother level of, just not feeling the impending low or feeling the high or feeling the rebound. Those everyday experiences are really tough. And I think there are days where you don't sleep. There are days when you cry, especially in these early years. There are days when you feel like just the world is coming down on you. And, at some point, at least in my experience, you have to decide to use all of that emotion and all that energy to change your perspective, I guess. You have to become a problem solver. You have to become good at math. You have to become good at compartmentalizing. Something I've said repeatedly, in my advocacy about our early days is that it didn't matter how we were feeling, how my daughter was feeling about not wanting to get a shot, that we had to do it anyways. Not that it never mattered, but in the moment and those everyday experiences when things are hard, you really do have to learn to not ruminate and just make change. So if you're feeling low and emotional, you eat the sugar. If you're high and your pump is failing, then you just give the shot. We don't take 20 minutes to cry about how we don't want a shot. We do the shot, then we cry about it, then we talk about it. So I guess to answer the question, it's using those everyday experiences to empower you to make positive changes, to become a problem solver. And at the end of the day, I have a little frame somebody gave me in college, in one of my college jobs that I still have today, that just says perseverance on it. And it's a picture of a plant leaf with a water droplet hanging on the underneath of it. And it just says, it's a matter of hanging on. And to me, that is really symbolic of being a caregiver to somebody with type 1 diabetes. Is you just need to hold on to that leaf, and it's heavy and you feel like you're going to fall, but it doesn't matter. You need to hang on, and you need to keep pushing forward. And it's a loaded question for me, but a good one.
Thank you so
Can
much.
I add something? Can I quickly add?
Of course.
Oh, thank you. You see, for me, it's quite different because type 1 and type 2 are not same. And so for me, my community, I represent type 1, type 2. So I give my support. As a person living with diabetes, I do not allow my living with diabetes to overwhelm me, because it's quite overwhelming, because I have become obese because of diabetes, okay? And that was because I didn't know much. And I had other children. I have 5 children. So I didn't allow that to overwhelm me. So I go into the community, I educate the women, I educate the children, I educate anybody that is trying to prevent diabetes. So that gives me strength. That gave me community. I create support groups. You're living with diabetes in this community, you need to come together, find other people that are living with it, hear their lived experience. When you hear other lived experience and you give support to each other, it helps to help you heal. That community is amazing. I found that our community, we don't come down with complication because we are educated, we are taught a lot of things. It's like a family. You understand? Just like we are in the Add Dog Voices, just like we are in the Blue Circle Voices, I have family across the world. So I don't see it. That's a gain for me. That's I give and I gain. I give and I gain. So that's what I see. So you give, you have strength, you have compassion, you see people come to you, cry on your shoulders. That is very important in our kind of community. But I can see that where we are coming from in different parts of the world, empathy, kindness is key. So as a woman who is living with type 1, I'm there for those. I go to camps of type 1 to talk to those young children because they face a lot of stigma. They don't have insulin. They don't even understand their body. There's a young girl, let me share a story. There's a young girl that was stigmatized in school. Not one, not two, but this particular girl, because type 1 did not allow her puberty to develop. So she's looking like a child. She was so ashamed. She's supposed to be in the high school. She withdrew because she couldn't cope with that. And that broke my heart. So by being there for her, strengthening her so she feels strong, she can go back to school, she can face her real world and not be ashamed. Stigma, discrimination is key. And I'm glad the world is meeting to discuss that. So that's how I give, but that's how I give and I give. Thank you.
Love this. And it's great to hear both perspectives. Of course, we have different backgrounds and different realities, so it's great to hear everyone's views. The next question is for Isabella. Coming back to something we asked in the slide at the beginning of the session, for everyone who joined later, we had some questions at the beginning. Do you feel women's health concerns are taken as seriously as men's?
In the sense of personally with diabetes, things that I've experienced, I think women are often labeled as dramatic or complaining about something or nagging too much. And I've found that that has carried across with my health. It is a very serious condition, and a lot of people don't understand it or its full effects. So people have jumped to, you're just a woman who's being dramatic and complaining. You need to calm down. It can't be that bad if you just need sugar. And what do you mean you're fine in about 20, 30 minutes? You know, it's a funny disease to try to advocate for, especially when you're in those sort of situations. So I think it definitely does have that effect when you pair it with a stereotype of how women are seen, especially with their emotions. And I think that that also carries on to how I see my health and how I react to it as well, because I go, well, I've lived with this my whole life, but maybe I am wrong, or maybe I am not seeing this correctly. So it does really then put you in a situation where your health is at risk because you're second guessing.
Marlena, go ahead.
Yes, if I could add, definitely agree with Isabella. There's been so many moments where I've just had like a really bad Mount Everest down to Mariana Trench days with my blood sugar, and I'm just super burnt out and moody, and I'm like snapping at everyone. And it's always my mother who goes, "Have you checked your blood yet?" I'm like, ah, okay, she knew. But I definitely think I had an issue a couple of years ago because I do feel like when it comes to women's health, especially when it comes to reproductive cycles, it's more, like I said, like stigma. It's like a taboo. Like people don't really want to talk about it because it makes other people uncomfortable, especially men. So I had some issues with my reproductive cycle. And I actually brought it up to my doctor for the first time. And I said to him, hey, this is the issues I've been having. And at this time, I was about 19. And he was all, oh, well, thank you for bringing it up. We can run some tests. So it took me actually standing up and advocating for myself before someone actually addressed the issue that I was having. Because before that, no one's ever talked about um, my menstrual cycle. And it never even occurred to me that it could be a diabetes related issue because it's just not talked about enough where I'm from. So it was like quite kind of eye opening to know that, oh, hey, actually, maybe I'm not the issue. Maybe the condition that I'm living with is affecting this. And it's not just in my head. So I think definitely speaking up for yourself and having more awareness of what can affect your blood sugar, what can affect your condition is very important as well.
Definitely. And I feel that my experience, of course, it was many years before. But when you're diagnosed as a child and then you go into your first menstrual circle, you have hormonal changes that you don't know how these affect your blood glucose, but also your pediatrician doesn't know either. So, or you can have this conversation with them. So it is a little weird, but now I think we have more studies and we more openly talk about that, but it's very important. And it's not only about that, it's much more because as you grow older, your hormones changing and this affects your blood glucose and your diabetes control. So the next question is very interesting. So I want everyone to answer it. We will start again from my screen so I don't miss anyone. Zarenko, you can start. In your experience, are there specific psychosocial factors that make diabetes distress different or more pronounced in women compared with men?
I wouldn't say yes. I would want to say is for let me see. Let me be sure that I understand that question very well. You could ask it. Let me understand it again. Repeat, let me
We
talk
can
through.
start with Carrie if you want to think about your answer and then move back to you. Do you want
No.
that?
Just want to understand the question. I wanted to understand the question. Can you repeat it, please?
Yeah. In your experience, are there specific psychosocial factors that make diabetes distress different or more pronounced in women compared with men?
Oh, yeah. For the fact that we women are the ones who give birth. So gestational diabetes come on easily to women, and most of them don't even know. I have some friends who have lost quite a number of children, and they didn't even know because they were having gestational, and the baby they are distressed, they have stillbirth. So they just counted that, oh, this woman is not fertile, she cannot carry a baby. That's why she's losing her baby. And that marriage ends, or the woman is stigmatized in my culture as a witch, evil spirit. So women, and then obesity comes to women easily. Once you start bearing children, or you're a woman, you're married, you start adding weight. So adding of weight, even as a puberty, if you take some preventive, what is it called? Preventing, is it what they call to prevent pregnancy drugs? They make you add weight, and that exposes you more to coming down with diabetes early in your life if you're already on that line. So I would say yes, a lot. In fact, our natural body, like in African women, we are endowed up and down, and these are not actually a blessing if you want to look at it, because obesity is one of the major things that can expose you to diabetes, here more in women than men. Yes, I agree that such things. And then for the fact that in my culture, women don't speak out, well, then in the days, but now we are trying to do a lot about it. Women speak out more now. Is that when a woman is not meant to speak out when men speak. So you see a woman not speaking out on time with her discomfort in her body. But the man will just come, a woman will be the one that will ask about the man, ask about the children, ask about the extended family, how are you doing? But nobody, she will not bring herself first to care for. She cares for others first. So that's why a woman being a change policy is very important. The voice of a woman is very important. When we women speak, we change policy, we change life with our lived experience.
I 100% agree because, women take care of others first, and they can be sick, they can be, in a position that they will not be able to control everything. And this is, I think, in most cultures, at least in Greece, it's exactly the same thing, which is sad. But that's why we do today's event, to inspire more women to speak and to see the results when women start speaking. Gary, do you want to continue?
Yes, since the questions about my experience, again, since I'm the primary caretaker of my daughter's type 1 diabetes, I have to speak from the mother's perspective. I would definitely say from that perspective that we are definitely more impacted psychologically, psychosocially, in all ways. These are our babies. We many times have carried these children or cared for them from a very young age. We are attached to them. We're in tune with their needs, with what their cries mean, with their bodily functions. Like we understand things at such a deeper level that men can't, for the most part, really compete with that. So I think just naturally we're going to be more impacted. When I had to prick my 3-year-old's little baby finger, it hurt me at a cellular level. And of course, in my experience, my husband lives with type 1 diabetes. He was diagnosed at 37 years old, I've forgotten the number now, I think about 7 years before our daughter was diagnosed. So I don't know how it would be for a father who doesn't have type 1 diabetes, but I'm pretty sure it didn't hurt my husband at a cellular level when he would prick her finger. I don't think it impacted him for hours afterwards or dreading the next time he was going to have to do it. It was just something he did for himself, something he had to do. Of course, it wasn't a great thing, but it impacted me emotionally in a very different way, and I think it does for a lot of women. And then I think, more on the psychosocial side, as I had said earlier in my introduction, this also kind of hits women in, advocating women mothers, advocating for their kids at school, because we are feeling this at a cellular level. We are managing this from our intuition. We're being an external pancreas for our children, and nobody understands what that is unless they do it themselves. So even my best friends had trouble understanding what that is and what that means. And when you take that burden to school and you're trying to get what your kid needs, I think we're often labeled as helicopter parents, and why are you giving your kids sugar all the time, and why do you have to be at these field trips, and why do you show up with a juice box to recess when nobody's responding to alarms that your child's going low. We just kind of, at birthday parties, like, did you eat the whole cupcake, and can you only have half the cupcake? And we're just seen kind of as neurotic because there's a little bit, there's such a misunderstanding about what diabetes is and what our children face if we're not managing it that way. So that's it was heavy for me in the beginning. Now it doesn't bother me what other people think. I have turned that around into thinking, good for them. They think I'm crazy. That means they have a great life. They don't manage diabetes. They can think I'm crazy. I know I'm not crazy. I know that every parent taking care of their child's doing what I'm doing at that birthday party. And I just let them, think what they want. If they want to ask questions, I'm all for it. But if they're just going to make judgments, have at it. I'm glad for you. Live your happy non-diabetes related life.
We can never control what people say, but we can control our actions or how we feel about those comments. So just keep doing whatever you do and don't care about anyone, If we cared, we would be depressed. And anyway, Isabella, do you want to add to that?
Yeah, just quickly. In Australia, I'm sure it's in other countries as well, but young females are at a higher risk of developing diabetes, burnout, and anxiety, and also depression compared to males. They're also, all type 1 females in Australia have a higher hospitalization rate, which then leads to government spending increasing, etc. And body image is another huge one, especially in Australia, hence the Diabetes Body Project that I am a co-author on, to try to tackle that in young women. So I know being diagnosed at 11 was, you're a preteen. It's not a great time anyway. It's kind of an obvious hand in hand. When I was diagnosed, I was actually at the exact same time diagnosed with anxiety and depression. And that, speaks for itself, really.
Thank you so much, Isabella. So our next question is for anyone who wants to add something to it. We don't have much time, but maybe one or two people very briefly. Maybe Marlena, you want to add something? What support mechanisms exist to help women leading grassroots diabetes advocacy initiatives in underserved community scale?
Okay, I'll be really brief with this, but my best advice on trying to get more support in more undeveloped or underserved communities would definitely partnering with a bigger NGO or using your resources, reaching out and talking to people who have the support and are willing to actually to reach out and work with you. Going to other charities or groups and showing them what you have and what you want to give and what you want to do definitely is the best way to try to get the quickest outcome, because there's so many communities out there who are willing to want to reach out and collaborate. So I definitely recommend this.
Excellent answer. Really well done. So our next question is for Ozarenko. Please be brief because we don't have, unfortunately, much time. But what practical role can women play in helping reduce global diabetes rates?
Global diabetes
Rates.
to reduce the global diabetes rates. Is it rates?
Yeah.
Okay. So what, like I made promise to the IDF president in the Bangkok conference, I told him that in Africa, we will be driving down the figure by changing the diet, introducing exercise into school. Mothers are the change makers. Mothers are the one who prepare the meal. Mothers are the one in charge of the children. Mothers are the one in charge of the men. So if you want to drive down the figure which is being projected, is by speaking and empowering women as we are now the voice to make the change. Talk to mothers, homes to please change the diet, and the mothers come up, join the advocacy group to change, to fight for the unhealthy diet that is being pushed, advertised in different countries across the world, that is driving obesity and increasing not this diabetes outcome, the ones we can prevent anyway, okay? Because for me, that's what I'm doing. And then pollution. Pollution is really affecting and causing a really health hazard. We need to look at it because type 1 is increasing. It wasn't that much, but now it's increasing. My community is increasing. So bringing that awareness, mothers are the key that we need to use to unlock and drive down the figures. The data, that's what I wanted. So let more women share their lived experience. As we are here now, don't go back home. Go back and push. Our story matters. Our story will change it in our different communities. So let's go back home and talk to them and not live in denial and be at the forefront of the advocacy.
Totally. And I want to add very briefly, because of course type 1 can be reduced as it is autoimmune, so you can control that, but to prevent type 2, it can, of course, it's not 100%. I don't want to be discriminatory, but in Greece, we have a say that, the father is the head of the family and mother is the neck. So the head can turn without the neck. And if people have high risk in developing type 2, it can be prevented by exercise or food. So women can lead on that, to force people in the household to exercise or to eat better. But of course, it's not only that, also to take them to the doctor for checkups, because a lot of times, and especially in Greece, so this is 100% my experience, but men feel they are invisible. I don't know. They feel that they will never be sick. So they don't go to the doctor unless it's very bad, like it's a very bad case. So a woman as the neck can force them there. Of course, it's not only men, but for themselves too, to hear that for them too. And they can all go together. So these checkups, the prevention, I think, is the key for type 2 diabetes. If you know it early, you can control it better, either with medication or exercise or food. So very small add. Someone else wants to add anything, or we can move to the next question? Nope. Okay. So for everyone, as our last question, very briefly, as we have like 5 minutes, what are you doing to empower the next generation of bold female advocates? I love this question. And whoever is braver can start. Ozarenko, you are the bravest. No, I'm kidding.
Education is key. The secrets, education, your lived experience story. Keep telling your story morning, night, and day. You will impart the word. You change the story. You change the narrative. And then educate from a young age from school. Educate, go to the work, every place that you can. keep educating people about diabetes and how they can contribute, support their family members, support the community, invest in diabetes, change the narrative. The healthcare should be more empathic. So it's education. We keep educating. That's what I'm going to be doing more, taking diabetes to school, to community, to churches, to mosque, to let the diabetes be the conversation on the table. Conversation on every table, not just selected table, every table, family table, political table, friends table. Let the topic be that. That's what I'm doing.
Thank you so much. Carrie?
I'll just quickly share a brief story as my answer. I have a lot of parents contact me and ask me if I know an advocate, if I know an attorney, they need somebody to help them with their situation at school. And what I'm doing to empower the next, generation of women leaders is to break the news to them that that's them. They are the best advocate for their children. And trying to give them the validation they need that their experience is it is unique to them, but it's not abnormal, that many of us have traveled that road, that we're here to support them and give them the resources that they need to advocate for their child.
Thank you so much. This is excellent. Marlena?
I definitely think from what I've noticed from who I look up to or who I see in my type 1 circles is that people who are authentic and who are open and they're true and that they don't take any not any criticism, but any negativity. Like they're so authentic. And I like to take that into my mindset because I do get a lot of questions, when I'm out in public or when I go and do talks, people ask me questions about my diabetes that a lot of the times I don't really want to answer because, I've done this talk a million times, but I think if I can make one positive impact and if I could tell someone about my diabetes that's not looked in like a bad light, then I'm doing my part. So definitely being your most authentic self, and people can pick up on that. People can see that you are confident. And I think being able to go out in public and talk about these things or having a social media presence or being involved in type 1 circles or diabetes circles in general can really push and empower other women or other young girls who are coming into this circle, because I didn't have many people to look up to who were also type 1. And I thought, well, if I don't have anyone, then I'll be my own advocate and I'll be my own inspiration. So I think it's going okay so far.
Love this. And Isabella?
Yeah, I think everything I do is kind of for younger me, who was diagnosed and was lost and didn't want to speak up. And I kind of carry that out in every day. If I see a girl with a pump or something, I will go up to her and introduce myself. And if she doesn't want to talk, that's okay. But just extending that olive branch, I suppose. I will always show my devices if I can, because you never know who's going to see that and go, oh, other people have it. Especially at the gym, I think that's a huge thing for me because there's a lot of misconceptions around that. But showing what you can do and who you can become with diabetes, I think, is the best way to empower the next generation, because they look up to you and they do listen and they do watch what you do.
I couldn't agree more. I really loved all your answers, and it's truly inspiring to see women leading their way to being great leaders, and you're all great leaders. So thank you all for your work and amazing inputs. I'm very, I'm very inspired. I'm like a participant, just fangirling now. But I want to say that today's discussion has shown us that advocacy can start anywhere, in a family, in a local community, or through a personal experience with diabetes. But when women are supported and empowered, their contributions can create lasting change in healthcare, education, and policy. And I really want to thank all our speakers for sharing their stories and initiatives. And thank you everyone who joined us today from around the world. It was excellent. We had so many people joining and staying until the end. The recording, slides, and feedback questionnaire will be sent to you in the coming days. So please keep an eye on your email and your spams and take a moment to complete the feedback form. For everyone wondering about the certification, this will be sent after April 6th. So don't stress about it now, stress about it in April if you haven't received it. And on behalf of the International Diabetes Federation, thank you all for being part of today's conversation. To all the women, but also all the men celebrating women, happy International Women's Day on Sunday. And have a wonderful rest of your day. Thank you all for joining.